Hi, and welcome to Denver Wellness Digest. My name is Chris Perez, and today I'm speaking with Harmony Wright, one of our psychiatric nurse practitioners here at Alleviant, and she's going to be talking about a topic that is of interest to her, anxiety versus ADHD. Hi, Harmony, welcome.
Hi, Chris. Thanks for having me.
Of course.
Yeah, I wanted to bring up this topic because it's very, very common in what I see in clinical practice and what I've been dealing with for several years, or my patients rather have been dealing with and have several questions about when they come in to see me. And often I'll have people who will be like, maybe adults, and they'll be like, I think I have ADHD, which can be kind of rare because we typically like to see the diagnosis or the symptoms at least before the age of 12 years old.
So just for clarification, it's possible to have ADHD, anxiety, or both?
Yes. And actually it's more common than not that an individual who has ADHD can have some form of anxiety. It may not be a full generalized anxiety disorder. And that kind of makes sense because if you think about some of the symptoms of ADHD, hard time, difficulty paying attention, sustaining focus, distractibility, and then if you're not getting your work done...
I'm sorry, what were you saying?
Oh, I'm like, what? I'm like, did that go off? Is that what? Like Chris here. Yes. But so the symptoms with ADHD, if they keep going on without treatment, without access to support, it can drive an anxiety disorder because
Gotcha.
You're falling behind, you're not able to organize tasks, and then with that you feel nervous.
Right.
And you worry.
Right.
But there are some distinct symptoms that with anxiety, it is a constant kind of ever prevailing sense of worry.
Right. So let's talk about real quick, like, say I'm an adult, I'm worried that I might have ADHD versus anxiety. What are some things that I can do at home before I schedule an appointment with a provider?
Often, so with anxiety, you can definitely do things that make you feel better that are not drugs and alcohol.
Right.
That is what I tell my patients. Self-care is what we talk about. So, if you have deadlines at work, right, that often increases your stress. So you might do things like, okay, I'm going to take a hot bath tonight.
Right.
I'm going to make sure I get extra sleep this weekend, or I'm going to plan, something special for myself when I get this done to see if it kind of helps you feel more balanced.
Right.
Because there are going to be times that we have increased stress or things that do make us nervous or anxious. And we can understand that that's situational, it's not going to last forever. What am I doing to feel more supported? Reach out to your family, your friends. You can journal. Often I have my patients look at YouTube videos on meditation or mindfulness. It's free so that you're not feeling like you have to spend more money.
We're going to put some links to some good, Harmony's going to find me a couple sites she likes, and we'll put some links to that so you can do it at home.
Absolutely. I started doing that stuff myself, like just listening to different music that helps you feel calm.
Right.
Right? Decreasing your stimuli. So if I feel like I work on the computer all day, when I get home, I'm going to not have technology.
Smart.
I'm going to decrease lights. I'm going to do things that self-soothe and help me feel better and more balanced at home.
So here's a question that I really have and is kind of near and dear to my soul as a caffeine aficionado, I'll say. And I know there's a ton of people at home who are doing the same thing, now that there's a lot of people working from home, that caffeine is so much more readily available when your coffee maker's right there. What should somebody be on the lookout for? I guess, let me ask it a different way. So people are working from home, they have much more access to caffeine. Where's the line between caffeine intake and anxiety increased?
That's a great question. So often individuals who are more prone to anxiety will tell me that they actually don't drink as much caffeine as people who don't have higher anxiety.
Oh, good.
Because they have attributed it to, I get nervous, my heart races, because at baseline they're already feeling that way.
Right.
Now, any of us can drink too much caffeine.
Yeah.
It is a stimulant. Individuals with ADHD can drink caffeine and do really well at work.
Yes.
Right? And so, but there is always that fine line with caffeine too, is if you're telling me you have a hard time sleeping, or difficulty at night, then I typically don't want you to drink caffeine after noon.
Right, okay, noon.
So that it's out of your system and it's not lingering around. Because it's interesting, we can build up a tolerance to caffeine to where I'm not zipping around or, you know, have tremors or anything like that. But what will persist is that alertness. And so, you know, often if somebody hadn't really talked about anything that they've done nutrition-wise, I am looking at caffeine. How often are you eating? What's your blood sugar? Or, you know, are you going prolonged hours without eating and then you can't focus?
Right.
You have no sugar, you have no protein in your body.
Brain needs sugar.
And caffeine suppresses your appetite.
Yes.
So if you wake up and you're drinking caffeine, you probably don't want to eat for several hours, and then you're like, I feel like crap, and I can't focus and pay attention. I think I have ADHD. It's like, well, let's start with a couple other things.
Yeah.
Let's try eating consistently, eating things that we know our brain and body like, and that fuels us consistently throughout the day.
And that's, you know, I want to make healthy food choices, right? Like maybe eggs or fruit in the morning, oatmeal.
Yeah, I mean, you know, I just had this conversation with a patient today around carbohydrates, right? We need carbohydrates. It provides our body with readily accessible fuel that it can break down easily. Right? We don't need refined sugars, simple carbs like candy, donuts, things that shoot our blood sugar up, and then our body secretes insulin and brings it down, and that's why we have these fluctuations throughout the day with our insulin and blood sugar. If you do, I like to eat carbs. I mean, I like bread, you know, I like things, so I often try to pair it with something that's a protein.
Right.
So if you want to do toast in the morning, add some peanut butter.
Yeah.
Add banana and peanut butter. Something that slows down the carbohydrate kind of drive. But we do need food and fuel to think.
Yeah, and this is something that I saw in myself while working in anesthesia, was that I really would gravitate towards that pure sugar, you know, candy especially, or donuts, and then feel great for about 30 minutes, and then once that crash set in, oh man, watch out.
Yeah, and then you're actually hungrier than when you first ate the sugar.
Could definitely feel the cloudiness, so once again, our friend refined sugar pops up.
Yes, which I know everybody's tired of hearing about. Often, depending on where my patient or family is at, that's where I try to meet them with nutrition.
Yeah.
Like my patient this morning has young children, and so I think about, she's got young children, a husband, she's probably cooking dinner, getting things ready. I'm like, you can eat the same things they eat, use a smaller plate.
Right.
Or eliminate some of the carbohydrates or empty kind of calories that they're eating, and eat the protein. Or things that seem reasonable that you don't have to go to Whole Foods and spend your whole paycheck on.
Yeah, paycheck.
And that you don't also feel like you can make, 3 different meals.
Yes.
It needs to be practical, and it needs to be something, practicality depends on a lot of things.
Yes.
Accessibility, affordability, and, how easy is it? So back with adults. So adults will find, sometimes they'll be in college.
Okay.
So then they're not getting the work done, and then they start really kind of evaluating, like, I've kind of always been like this. And my theory on that is, I feel like it's an educated one because I've had lots of case kind of studies around this, is that if you're not a behavioral problem in school, you can sometimes just pass by. You may not have A pluses, but you're not F.
Right.
And you're not getting suspended, you're not getting notes home. And so you can fly under the radar with ADHD.
Mrs. Hirschfeld, if you saw that.
Right? Yeah.
Yeah.
And so, and I will say a lot of adults who come to see me, they've tried a lot of different things.
Like what?
They've tried study skills classes, or they have a tutor.
Gotcha.
Or they maybe have tried like natural remedies that are, say that they can help with focus or concentration. Sometimes, which is frowned upon, they might have tried their friend's medication.
Right. Yeah. Please don't do that.
Yeah. We don't like that.
We don't like that
at all. We'd like for you to get your medications prescribed to you.
Yes.
And so then I've had so many patients, which, I mean, it's a good thing, but I feel like, man, I wish I could have done this for you like 20 years ago.
Yeah.
Because a lot of times individuals will develop this insecurity, like something's wrong. Like, why can't I learn the same? Why can't I do this? And then we treat their ADHD and like that.
Wow.
Yeah, that's what I mean, I love ADHD patients because it's very easy to treat for in the most case if it's just straight ADHD, because that's the one mental health diagnosis that medications do remit the symptoms.
Right.
You take the meds, as long as you tolerate them, you don't have side effects or feel worse on them, you can focus.
Like what kind of side effects?
Side effects like it made me feel like I couldn't eat, and then I had stomach aches or kind of nervousness on the medication, and so they didn't want to take it, which makes sense, right?
Yeah,
like
no, it totally makes sense.
My rule of thumb with medication, what I always tell my patients is, I want you to feel better, not worse.
Right.
If you feel worse, you're not going to want to take it.
Right.
And I'm not going to ask people to take medication that makes them feel worse. The stuff that we use, the things that can be helpful for ADHD even alone, is magnesium.
Okay.
And depending on your age, you can take over-the-counter magnesium twice a day, and magnesium helps your neurons in your brain communicate better. So if we don't, about 60% of children with ADHD have magnesium deficiency.
Wow.
Yes, it's awesome information
That is
because
awesome.
you can add magnesium, and compared to placebo, somebody who didn't take anything, like 60% of their symptoms remit.
Wow.
Right. So, and the reason why we have magnesium deficiency in our country is because our soil isn't nutrient rich enough. You know, so even if we were vegan and we're eating lots of vegetables, you still wouldn't get enough magnesium. It's not something that we do a blood test for.
Right.
Because there's so much data to suggest it, we can kind of go off of, you're magnesium deficient, let me give you magnesium, and there's no harm in it, per se.
Per se.
Per se, yeah. You know, and you're not going to become toxic on it, although we
Right.
don't do like really super high dosages of it, but it's something that you can give individuals and it's safe.
Right. I believe, and you can correct me if I'm wrong, really some of the most negative side effects are diarrhea.
Yes, so there are
Right.
certain forms of
Certain
magnesium
forms.
that will, yes, trigger diarrhea.
But for most over-the-counter preparations, they tend to be, I don't want to really say doses significantly, but as long as you're staying within 1 to 2 capsules per day, you're probably going to be in a safe range.
Yep.
And if you have any kind of cardiac issues or anything like that, we want you to be evaluated before you start taking these kinds of medications. Because they can affect blood pressure at certain amounts, but I can tell you firsthand that magnesium has helped to make me just a more overall calm and less reactive type person.
Right. Great, and that's great. And the other thing that magnesium helps with ADHD is that if people or kiddos have side effects, it helps decrease the side effects from the stimulant medications. And the reason why is because a lot of times if our diets are deficient in something, we can put medication in, but the body, it just sits there.
Right.
And when medication sits there in the body, that's side effects.
Gotcha.
So if we are able to metabolize the medication, then you have less side effects. And so that's kind of where side effects come. I mean, there's other supplements too, which I would say schedule with your provider, talk more about these, but there's vitamin B6 can be helpful, and so can zinc.
Right.
So magnesium, B6, and zinc all work together for cellular health.
One last thing, and then I'll let you go. When should somebody reach out to a provider, or when should somebody really look for professional help?
I would say whenever you think about it. When you meet with myself or somebody like myself, it's an evaluation.
Right.
So a lot of times there's just a lot of information sharing. There's a lot of kind of assessment of different things that can go on. And often that evaluation might turn into, here's some resources. Try these other things. It may not be a traditional psychiatric, recommendation, or it might be. And I would say that one thing that I'm always kind of aware of, or I don't know if it makes me kind of like feel a little sad, is that I'm like, I wish you would have came sooner.
Right.
That's more of what I hear. I really don't, and I know that a lot of people think that people just go to the doctor or go get help. Not in mental health.
Yeah.
They wait until they feel like, okay, I'm bad enough. And you know what? You don't have to wait that long. And I'm not going to just jump to like the most, the strongest medication I can find or recommend, you need to go to the hospital or anything like that. It's, it's a spectrum. And if it's information, we start there. If it's medication, it's there. If it's extra supports, we start there. There's so much more information that we can help and you maneuver and understand so that your mental health competency increases. And then you don't need me anymore.
Right.
You just take care of yourself. And then you help your friends and family.
Right, that's the goal, right?
Yes, exactly.
So if you are thinking about getting help, if you do want to talk to somebody, follow the link below. We'd be happy to get you an appointment with Harmony or another fantastic provider as soon as possible. All right, thank you so much, Harmony.
My pleasure.